Hello everyone, I'm Dr. Asish Reddy, consultant microsurgical andrologist, Andro9 Hospitals, Begumpet, Hyderabad. Today we are going to discuss about the treatment plans in azoospermia. Azoospermia is a condition where you have a zero sperm in the semen, which is a very commonest thing. We generally don't discuss it, but this is a commonest thing with 0.1% of occurrence worldwide. So azoospermia, where the semen will be patient will be getting semen, but in that the sperm content will be zero. So we need to first see what is the problem for zero sperm, whether it is an obstructive azoospermia or non-obstructive azoospermia. So obstructive azoospermia is a condition where this testis produces enough sperm, but the way for the sperm to come out might be blocked by different infections or the tuberculosis. So in these conditions we will just relieve the obstruction, and the patient will be having again normal semen, and in that the sperms might be present in the future. Now coming to the most important part, non-obstructive azoospermia. So people who are having non-obstructive azoospermia, you don't need to worry. Always make sure that your hormones are within normal range. So in non-obstructive azoospermia, the most important hormone which we need to see is inhibin B. So this, remember this hormone inhibin B. This hormone, when in the normal levels, that means your testis might be producing sperms, but the volume might not be enough to come out. So inhibin B is an important hormone, FSH is an important hormone, LH is an important hormone. If these hormones are within normal range, that means there is some presence of sperms. So you don't need to worry about it, because there is something called microtesticular surgery. So microtesticular surgery is we open the testis completely, and under 35x microscopy, under microscope, operating microscope, we will open the testis and we will try to find sperms from the different areas of the testis. First we do a detailed testicular mapping. In this testicular mapping we will understand where we might get the sperm inside the testis. So we divide the testis into 16 zones, 16 to 20 zones depending on the size of the testis. In each zone we will try to find sperms. So this surgery might take 2 hours to 10 hours, because unless and until we find a sperm in this surgery, the surgery will continue like that. But before going for microtesticular surgeries, we always optimize the patient for at least 3 months. We will put them on human chorionic gonadotropins or menopausal gonadotropins depending upon the patient's individual conditions. If we optimize the patient for 3 months, after optimizing the patient for 3 months, we will try to operate it. After seeing the inhibin levels, if inhibin levels are good enough, that means our surgery might get succeeded. And there are so many conditions where inhibin was normal but we couldn't find sperms, and in some conditions the inhibin content was very low, but luckily we found sperms. So these sperms, once found by microtesticular surgery, will be only used for IVF. So this we will send this these sperms which we found in microtesticular surgery, and this can be used for any kind of IVF procedures. Either it could be a ICSI or IMSI or any other techniques as such. So these sperms, there is no need for motility as such, because we are using it for IVF. There is not much of importance, unless and until the embryologist wants some kind of motility, they'll add a theophil into it, and they can definitely use that sperm for an ICSI. So all the microtesticular surgeries are very complicated surgeries, but finding a sperm is a very important task. So please everyone remember, anyone is having an azoospermia, you don't need to worry about it, because we get patients from all over the world where they said impossible, and we found sperms in most of the cases. So this is a most important surgery, and you don't need to worry. If you have any further doubts, please come and see me at Andro9 Hospitals. Thank you.